Central Illinois is the CI in CI Living. CI Health is brought to you by Aunt Martha's.
Millions of people have taken the first step to protect themselves from COVID-19, but there's a second step, or maybe a third step, depending on how you look at it, with the booster shots. And with more details from Aunt Martha's, we have Dr. Tamara Lim, Medical Director and Senior Vice President of Quality and Clinical Excellence, joining us. Hi, Tamara. How are you?
Good. How are you? Thank you for having me today.
I'm great. I think I just saw not too long ago that when it comes to the booster shots, these have now been approved for a fair amount of the population. Talk about why the booster is necessary and who's supposed to get it.
So the booster shot is really important. I think a lot of data has shown that the immunity over time has weakened for those that got the primary series, especially for the mRNA vaccines, which is Pfizer, Moderna. So they've noticed that after 6 months, that weakened immunity is probably causing some breakthrough cases, which is why a booster shot is very much necessary to really optimize that immunity and kind of prevent that continued transmission and breakthrough cases. Initially, when the booster shots were, approved, it was for a certain population. So it was for 65 and up, and then 18 to 64 who have certain medical conditions or who live and work in high-risk areas. Now, though, the FDA and CDC have expanded the eligibility, so it's for anyone 18 and older, especially as we go into the holiday season with all the get-togethers and as well as the breakthrough infections that have increased slightly.
We've heard lots about the different strains now of COVID, kind of like the flu. I think it's similar anyway. You can tell me if I'm wrong. Is this booster designed to knock out any of those new iterations of COVID, or is this simply strengthening our protection against the original?
So it's a little bit of both. So they did do studies on the variants, and when they make vaccines, they kind of make it not generic in a sense, but they make it so that it's able to cover the mutations, because any virus can mutate and have variants. So COVID-19 is not new in that. And so in looking at how viruses work and how they mutate and grow, when these vaccines were created, part of that genetic makeup in that vaccine and how they were going to make it was supposed to respond to that. So even if it's not 100% against any variants, which we know no vaccines are 100%, the job that it's supposed to do is really to prevent against severe complications and hospitalizations and death, and that's what it's doing. And that booster shot will then really optimize that immunity to do the same as well.
Obviously, there's been plenty of argument throughout the population about what's safe, what's not, what's necessary, what's not when it comes to the initial vaccination. But now with the boosters, are there things that are going around, maybe myths or things that are incorrect that people are believing about this that just simply aren't true or that we need to know?
Yeah, I think the major myth that I hear in my practice is that, or a question that has come from a myth, is whether or not COVID-19 vaccines are really working if we start talking about boosters. And so I think part of this also goes back to what I talked about earlier, which is, variants do happen, breakthrough infections do happen. No vaccine is 100%, but yes, the COVID vaccines are working. We know that it's helping in reducing hospitalizations and deaths due to COVID-19. We also know, as we look at the data, since this is such a new vaccine, and we continue to follow those that were in the clinical trials, that those immunity levels look like they are decreasing, and that is leading to these breakthrough infections and other cases, especially for the vulnerable population. We worry that if they get a breakthrough infection, they could get really sick. And so it makes the case for why boosters are necessary and why people should get them, while they're still available.
Final question / clarification for you. Getting the initial vaccine or the booster doesn't necessarily prevent you from getting it, but it could, if you do get it, prevent the symptoms from being as severe. Is that correct?
Absolutely. So, the goal of, vaccines in general, and this includes the COVID-19 vaccine, is really to prevent death and severe complications. With no vaccine being 100%, I think it's just, when people think like, oh, then no one should, get COVID-19 if I got the vaccine, that's not really true. It's really to minimize, if they were to get a breakthrough infection, even after being vaccinated, to really minimize those symptoms and those chances that you need to be hospitalized due to getting COVID-19.
All right, really helpful information. Thank you. We appreciate that. And if you have questions at home about your booster when it comes to the COVID-19 vaccine, or want to learn more about Aunt Martha's and how they can help you with your health and wellness, we'll connect you with all of that information, including links to their Facebook page and website at our website, ciliving.tv.
Well, as you know, information seems to always be changing when it comes to eligibility for the booster vaccine. The new news is people ages 16 and up may get the Pfizer booster as long as they've had their first 2 vaccine shots.